on YouTube exclusively, as we're doing right now on the enchilada. A lot of good things to talk about today. Coming up, Kelly Victory will be joining us at the bottom of the half hour. We'll have Double Talk and Gavin Newsom on there. But the one thing is that you really got to know is Orange County just threw a bombshell on the whole coronavirus statistics and stuff. And if you didn't think Double Talking Lion Gav Newsom was enough, or the people that, the statistics and all this, and people are thinking, this isn't right. Wait till you hear what's coming up on the show today. As we're getting ready to set up on Facebook Live. Just as long as you get 3 or 4 seconds to spare, it's no problem. We're coming to you as you hear that funky slide guitar music comes on every day live at 5 on Newswire and on Facebook and YouTube on that. We're crackling off today's show, and it will be like no other. Like we said on YouTube, of the deal on that, you got Double Talking Gav on the whole enchilada on this thing, and the incredible amount of blank, what that goes on in this is absolutely incredulous. So we had 2 big bombshells today. One from the Orange County, I think his name is Dr. Chow. He's the head of chief medical official of Orange County, and then Newsom, of the absolute scare tactics that are going on in this. The ad now that the state of California is, the fear-mongering ad that's coming up, we'll play for you, I should say, here in a minute or two, and the one from Orange County you're not going to believe. 30,000 starting in April. If I read this right, and I mean the good doctor down there in Orange County, the head official of Orange County, he's a little bit hard to understand on that, but he said, starting in April, if I understand the way he says, we were including all of them, antibody tests, coronavirus tests, everything, and sending them in all the way through June, they're saying now. Now he's saying that they're not of that going on the deal, that the state knew that they had them all combined. So there's a potential. I don't know how the state was able to figure out what it is, but an antibody test means you have been exposed to the coronavirus, but you do not have it. You are actually immune. You in most cases, you are immune to the coronavirus. So when you get to this and they were throwing all the statistics in with the positives and everything else, positive cases that were coming in, and all that. So there's a potential of 30,000 of the cases they're saying are the 30,000 that are positive of that. They're saying they're not. I would defy the logic of how they figured this stuff out of that. But as you get to it on the deal, and tell me when you get that set up, because I want to dig that one video out, that it's absolutely crazy of what's going on the deal, because I could not. I mean, in some respects, it was hard to understand what he was saying of that, or if he was really saying what he was saying on this deal, because it was like, what are you talking about here? So we're going to play Dr. David Chu as he's going on this. This is Dr. David Chu, Orange County health official of that. Here we go, I think.
Case rate and testing positivity percentage increased hospitalization via the percentage change in a 3-day average of COVID-positive patients, and limited hospital capacity via ICU and ventilator availability here at the local level,
which means
as does the state for all California counties.
Capacity.
Now I would like to pivot to a subject
point.
I know our reporters have been asking about this morning. News that serology test results was mistakenly included in the daily case count updates provided to the public on our website. In short, on April 28, CalReady, the state's reporting system, added COVID serology tests as auto-processed tests. My team captured these test results as part of their all COVID test report, an error that leadership became aware of around June 3rd. At the time, several changes to data reporting were in process, including changes to reporting of test numbers. The removal of serology tests was formally implemented on June 26, when we released the new website. But the serology positive result was never included in the daily case count moving forward since June 3rd when we found out. So our case definition stated that only PCR testing can be used to confirm a COVID-19 results, but they were included in the total accumulated number of tests reported on our website until late June when we released the new version. I would like to sincerely apologize for any confusions on this matter that has caused for the community. In the future, I and my team will ensure that we will continue to do a better job to be more transparent with respect to the data that informs policy and personal health decision on our residents. So with that, thank you. I would like.
Okay, so there you go. We've been on the phone with the PIO at Orange County, and notice they didn't say how many cases this were. The number I got was 30,000. And they cannot answer at all on the deal of how many cases are, how the state determined, when you just put them all in the pile, how the state determined that the serology, which means the antibody cases, were not included in this. Notice they didn't say how many cases this were. The number I got was 30,000. I mean, you cannot, and they cannot how do you make this stuff up at all, I mean, on the deal of how many cases. I was going through the thing, and it's like how they determine, how the state determined. How did they determine that? They can't tell you how the state determined. If there's a way that they could have figured out, how did the state figure out that you weren't getting included in? Notice they didn't say how many cases this were. The number I got was 30,000. How did they determine? And they cannot. How do you make this stuff up? Again, it makes no sense at all. I mean, on the deal of how many cases. I was going through the thing, and it's like how they determine, how the state determined. How did they determine that? They can't tell you how the state determined. If there's a way that they could have figured out, how does the state figure out that you weren't not included in? Notice they didn't say how many cases this were. The number I got was 30,000. How did they determine? And they cannot. How do you make this stuff up? Again, it makes no sense at all. I mean, of the hospitalizations, I was going through the thing, and it's that like how they determine, how the state, how did they determine that? They can't tell you how the state. If there's a way that they can roll it out, how does the state figure out that you were not included? Notice they didn't say how many cases they were. Ridiculous. How do they cannot? And they cannot. How do you make this stuff up? Again, it makes no sense at all. I mean, of the hospital, there is going through the thing, and it's that like how they determine, how the state, how did they determine that? They can't tell you how the state. If there's a way that they can roll it out, how does the state figure out that you were not included? Notice they didn't say how many cases they were. Ridiculous. How do they determine? And they how do you make and again, it makes no sense at all. I mean, of the hospital, there is going through and that like how they determine, how the state, how did they determine? They can't tell you how the state. If there's a way that they can roll it out, how does the state figure out that you were not included? Notice they didn't say how many cases they were. Ridiculous. How do they determine? And they how do you make and talk about again? It makes no sense at all. I mean, of the hospital, there is going through that like how they determine, how the state, how did they determine? They can't tell you how the state says, There, people can die, like your mom, your grandpa, your friends. Wearing a mask slows the spread. Notice they're not putting any audio behind this. Except let's see if we can replay that.
What you're going to start
Here, he's got the
on your TV
audio.
screen.
Here it goes. Says even without symptoms, you can spread COVID-19. People can die, like your mom. People like your grandpa. Your friends. Wearing a mask slows the spread. Wear a mask. Slow the spread. Notice they don't say stop the spread. Notice that that it goes across on this whole thing,
Business and jobs are
and
covering
you get nothing as far as that. But if you have a barbecue, if you invite your friends over, if you have any social distancing, you could kill them. But it says slow the spread, not stop it, because the amount of cases will always be the same. This is what we're fighting, folks, all across the board. It's absolutely incredulous of what is going on in this stuff. And for the actual stuff, I'm going to run this again, and here it is, and you can see that. It says even without symptoms, you can spread COVID-19. People could die. People like your mom, your grandpa, people like your friends. Wearing a mask slows the spread. Wear a mask, slow the spread. Now, if that isn't the ultimate thriller on how this stuff works, or they're putting the fear into you, this double talking, lying of a governor went through the whole thing. He doesn't tell you that 62% of our hospitals are occupied. 46,000 are in our hospitals. We have 73,000 beds. 62%. And we're having this crisis going on. And, the world's coming in. The positivity rate is up, mainly because Orange County and who knows how else are sending in statistics that are bogus. They said mask could not protect you. It might protect you from spreading it. Now masks protect you from spreading it, and everything else that's going on in this whole thing. So it's absolutely ridiculous and stupid of what's going on this whole thing, because they're double talking. Oh, we apologize on this. No, they're not saying, maybe our statistics are way off. Maybe the reporting is not worth a darn. You've been lying to us about masks. Either wear them, don't wear them, not wear them, anything else, or all this other stuff. But today, this stuff, and Newsom was just all over the place. He was double talking on this whole thing, all over the place. And reiterated, he's standing out the strike force, which I thought was off the table. Oh, militarizing the police and all this. He's using words like he's going to send his strike force, CHP, Cal OSHA, alcohol and tobacco agencies, any licensed agency out to get Southern California or California businesses that are not conforming, withholding money and everything else. The threats this clown is coming up to are absolutely incredulous of what's going on. And not to make matters worse, and we're going to have here in a second or two, Stephanie's going to join me, and we're going to talk about we're going to expand on the white guilt and all the tactics that they're using, because, man, they're rolling the fear tactics out, the scare tactics, the Hegelism, the communist stuff that's going out, right on that with Black Lives Matter. It is a Marxist organization according to their founders. So those of you that are supporting this and all that stuff, this is where you're at. So here's the clip we're coming up with on that. So get ready to roll it, let it rip. A lot about hashtag Black Lives Matter. We played the clip many times of Patrice Collier's, one of the three ladies that started Black Lives Matter in 2010. So, a little history lesson. 2010, Black Lives Matter as an organization started coming out of the Trayvon Martin, George Zimmerman case, where Trayvon Martin was shot by George Zimmerman, and started us on this 10-year trail of, disruption, deception, and deceit that's been going on. But in her own words, she said, "We are organized Marxists," in 2015. So we're going to start with just a little bit of a history lesson. Marxist, what does that mean? That came from Karl Marx, who came to power with Frederick Engels in the mid 1800s, and wrote some little document called the Communist Manifesto. Some of you might remember that if you studied in your history books of Fidel Castro when he took over Cuba in the 50s. And he, cited that, and Khrushchev and Lenin and all that for the Soviet leaders held to those tenets up until, well, still do, but the last one that really was pushing that, or when the Soviet Union, as we know it, collapsed in 1989, and as Reagan said in 87, Gorbachev tear down that wall in East Germany, and it finally did fall in 89, shortly after Reagan finished his second term as presidency. They wrote this manifesto of that, and this is the beginning of communists was started by Karl Marx. And this is one excerpt from that, the Communist Manifesto, that he and Frederick Engels argued. The communists do not form a separate party opposed to the other working class parties. They have no interest in separate and apart from those of the proletariat as a whole. They do not set up sectarian principles of their own which shape the mold of the proletarian movement, which means there is no individualism, no right of property, anything like that. The communists are distinguished from the other working class parties by this only. The national struggles of the proletarians of the different countries they point out to bring the front to the common interests of the entire proletariat, independently of all nationality. They want to destroy any sense of community, family, or any organization other than them, the government, the communists. Number two, in the various stages of the development, which the struggle of the working class against the bourgeoisie that has to pass through, they always and everywhere represent the interests of the movement as a whole. So just stop at that point. It's not about you, your family, individual, private property rights, or you get to keeping the fruits of your labor. Everything goes into a pile, and supposedly we're all splitting it up equally. There's no anybody. And if we run out of stuff, then you get rationed. So further quoting from the Communist Manifesto, the communists, therefore, are, on one hand, practically the most advanced and resolute section of the working class parties in every country, that section which pushes forward all others. On the other hand, theoretically, they have over the great mass of the proletariat the advantage of clearly understanding the line of march, the condition, and the ultimate general results of the proletarian movement. Understanding the line of march. What have we been seeing a lot lately?
I just have a hard time believing that that's what it really is. And I think a lot of, like I've been saying this whole time, I think a lot of people are too. I mean, it's sad, but then I don't understand the whole thing as a whole.
So
whatsoever.
Not
that I don't get what you're saying, I just don't understand why people would act that way.
Yes, but what I want to do was, what I wanted to show was, and we talked yesterday with Isaac Knight, and he'll have a new article pointing this out. When I said, when Gavin Newsom, when we put it up there, and he had hashtag Black Lives Matter on the governor of California's website and all this stuff of that, and I said, Gavin Newsom, they're not supporting you. When you do that, you're supporting them.
Right.
And then this is what Black Lives Matters is all about. They're not
really not to cut you off. And
go
I'm
sorry.
Ahead. He should have never supported that without further investigating what it really meant. I'm very disappointed that he didn't do that.
I'm very glad
as our governor.
I'm very glad you are disappointed, and I hope more people, like you said earlier, earlier, and I think we talked about yesterday, and you did a little bit, you're not understanding it.
Right.
I'm hoping more of the people that are out there marching that have no idea what this whole movement
Because to me,
is all
it's
about.
like, what is it going to bring? You're out walking the street. I mean, that's great that you're getting your exercise in, but that is like and I'm not trying to be heartless or cruel, but I don't get what they think it's going to bring, especially destroying things. That just makes me more mad.
And let's just go back to to this presidential campaign and the Democratic nomination process. You had the two most popular ones that were spouting the Marxist ideology were Pocahontas, Elizabeth Warren, and B.S. Bernie Sanders. And a lot of those, and most of the ones you see out there doing the protests and Black Lives Matter, they were supporting either Elizabeth Warren or Bernie Sanders.
Right.
And they were preaching this, like Bernie Sanders, who needs to make more than $250,000 a year? Or it could have been Pocahontas or whatever stupid number they're.
Which, I mean, to live, you don't need to. But if
No.
someone can make that and their own success, why would you stop that?
Amen.
That's them going and getting that. Good for them. You should applaud that.
You must have watched the 10 Hours of Free to Choose by Milton Friedman.
Of course.
Of that. No, I bet you that little clip of, between Phil Donahue and Milton Friedman that we played the other day of that on the show, of that, and that's it in a nutshell. And Phil Donahue said that, the same thing. Oh, why should anybody, what's the virtue of this, the evil of having, why should you, Phil Donahue, which is probably worth 30 or 40 or 50 million dollars because he was married to Marlo Thomas. They were both very successful, either in the media, actors. Marlo Thomas was Danny Thomas's daughter and all of it. The guy was worth gazillions of dollars, but he's saying, oh no, he's going around spouting, and like Bernie Sanders or Pocahontas that are worth millions, and they're saying, oh, nobody else should be making this,
Then
But
they should donate all their money.
yes, why aren't
If
you
they
living
don't
on
need
50
it,
grand a
then-
year? You can live on 50,000 a year.
Right.
I mean, what's the number on that? Where is it at?
Right.
But I wanted to show this of that because it's one thing, and one of the great, probably the first great newsman that ever came out in the 50s, and he was actually in L.A., was paid more than Walter Cronkite was doing nationally. It was George Putnam. He started out here in KTLA Channel 5. In 1950, he was doing the news in New York. He came out here, California. KTLA brought him, paid him like $250,000. And that was like 6 times more than anybody media guy made at that time.
Right.
And he was a big deal. He was an icon in the Southern California area and was broadcasting almost up until the day he died at like 89, about 4 or 5
for
years ago.
him.
But he was on TV on that. He had one reporter's opinion commentary. He did a radio talk show host for about 20 or 30 years. George Putnam's Talk Back, noon to 2 every day. Certain of us crazies used to listen to him a lot on that, yes. But that's what he said. He brought to me, I remember listening to him, he said, this is all about Hegelism. Hegelism is create a crisis where one doesn't exist, and then you walk in with a solution. And this was who do you think was a big follower of Fritz Hegel?
Who?
None other than the aforementioned Karl Marx and Friedrich Engels, the authors of the Communist Manifesto. So this goes back when I talk about, or when I said, or when I brought that out, and we did a little, we've done a couple clips on this, when I said, like with the Black Lives Matter, and we talked about it yesterday with Susan Shelley, of that, oh, well, you don't support Black Lives Matter? Well, you're a racist.
Right.
Well, no, I'm not a racist of that. No, but Black Lives Matter stands for Marx. No, if you don't support Black Lives Matter, you're a racist.
Right.
Because they can't argue the facts of that. This is what Black Lives Matter is about. That's why I said, and we'll have Isaac Knight back on when he writes the second piece that he did. Go to politicalvanguard.com. You can go to my site. We'll put it on IE Newswire too, but you can go to my page on that and link to the article that he wrote on on this subject, and he's going to follow up on it. And as I've said, more people like Shelby Steele, Isaac Knight, need to join into this movement, and more people need to stand and say the emperor has no clothes.
Right.
Not, if the emperor tells you to do this, or enslaving, or give me all your money, or we're going to do this, and it ain't right, or it's going to take something for you or your family, like we're getting that. They want to do that, but how do they do this? Conquer and divide. The best way to get people to conform is to break them away from other people, destroy the family unit, tell you not to have contact with this. And what is Gavin Newsom and a lot of them saying today? Gavin Newsom said it today. Oh, don't go to your family gathering on the 4th of July. You might kill Aunt Susie or Uncle Jose or what the heck ever, the whole thing. Oh, we heard that at the beginning, and we went through that. We played the clip of Dr. Scott Atlas, saying the statistics and all that stuff are bogus that he's given out. But again, it's important. If nothing else, don't be locked in or succumb to the fear that the fearmongers are spreading.
Exactly. I don't know. I hope it ends soon. I don't know. I don't get it. I don't get why they're still protesting. It's been how long? And then I just heard on the radio the other day, and I love this, and I'm not trying to bash anything, but now there's a new radio station for black people, for black news. And it's like, and then there's a TV show, which that is great. If you want to cover the history of your culture, that is a beautiful thing. But it's heartbreaking that it's being developed in the world that it is, and why. It should not be a new radio station because they feel like they need it to get their voice out there. There should be a radio station to teach my younger children the history of where they came from. I mean, embrace it. Don't make it like you're a victim and they're acting like they're victims. I mean, how would it be if there was an Italian radio station for Italian news?
Yeah.
Would people freak out?
Oh, could you imagine
if there was an Italian TV station that covered the history of Italy or in Europe? I mean, come on.
Well, and there's the Black News Channel. Can you imagine the uproar if Roy decided tomorrow to start the White News Channel?
And exactly. And I find it, I really do think it's a beautiful thing. It's great. I mean, if you feel like you need to have a news channel and it's going to make anybody feel better, that's great. Make people feel better. Spread the love. Spread the education. But let's do it because you love yourself and your culture and not be because you feel like you have no voice, because you do have one.
And it's exactly right. That's why I'm showing that. And there is real, per se, okay, you want to start a Black News Channel? And that's why I put the example. If you started the White News Channel, could you imagine the uproar? You talk about protests and burning things down and making you apologize and backing people up like they did Drew Brees when he talked about the kneeling stuff and everything else. And again, same tactic. That's what they do. They try to publicly shame you because the facts are not on their side. Their tactics are evil. I've said that. And tell me I'm not wrong. What Gavin Newsom is doing to California is evil. He's double talking out of the side of his mouth because he doesn't want to lose the support of one group of that, but he's willing to sacrifice another group for his own political gain. And that's what is, and again, you tell me how that is not evil, and we can go on with the poverty pimp,
1 minute,
and the whole crew of that's doing all this, Nancy Pelosi and all of them. The whole thing is going on for this, and that's what the vast majority should want to stop for no other reason than if you want a harmonious society, not only to live in, but your children and their future generations. That should be the best motivator I could think of.
Exactly. And
30 seconds.
Stop with the colors. Stop with the black radio. Stop with the black TV. Stop with the white radio, the white TV, the Hispanic, all of that. If you want it, put it on the History Channel, and let's get it that way. I mean, to me, that's all we need. We just need to all hit the reset button on 2020, bring in 2020.5. I know we joke about it, but
here we go.
Really
10
I
seconds.
think we're getting that desperate.
1490am.com and download your free phone app today. IE Newswire Daily is on the air.
The following is a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily those of radio station KMET, its management, employees, or affiliates.
Funky slide guitar music comes on every Monday through Friday on the Monday Bit, 1490 KBT, broadcasting all over the Inland Empire on that, where you get the real information that you will not get in a lot of other places. On top of that, on top of the statistics that we got, and we'll have hopefully Dr. Kelly Victory here coming on in a couple minutes, but of the white guilt and what Black Lives Matter stand for, and what it really means when you are endorsing Black Lives Matter, or the motivation behind shaming you if you don't support Black Lives Matter. You're called a racist, everything else. No, you don't. How many people support the Communist Party? How many people support Hitler? When you're supporting them, you're supporting the Ku Klux Klan, whomever. When you endorse them, you're supporting them, they're not supporting you. So when you support Black Lives Matters, you're supporting a Marxist organization out to destroy the United States of America as it is today. And excuse me for pointing this out and not buying into that rhetoric. As we talked about, the communists, the Hegelism, create a crisis where one doesn't exist, and then walk in with the solution. The tactics we talked about, trying to shame you at whatever, to get you to conform. As we did in the first half hour, the Gavin Newsom new video out, same thing. If you may have COVID, you may kill your mom, you may kill your grandpa, you may kill your friends if you go see them. When the statistics coming out across the board on that just came out in Orange County on top of what Gavin Newsom did was absolutely astounding of what was going on. But to discuss all this and bring us up to date, and there's plenty of things to update us on, not all things coronavirus, COVID-19, and everything else on the world. We have that famed trauma surgeon, disaster preparedness expert, consultant to many major corporations on medical issues, and just all around just about right on darn near everything I've ever seen. Dr. Kelly Victory, welcome to IE Newswire Daily with Roy.
Hey, Roy, great to be with you. I'll tell you, every day I wake up, I feel like I'm in the twilight zone now. It just gets more and more bizarre as I read the doubling down and new mandates. Honestly, you've got to understand the actual data, the facts on COVID-19 are really incredibly promising. We've seen a significant drop in the death toll since now for 8 weeks. It's not just an anomaly for the last few days. It's been for 8 weeks since the early part of May. It started to really drop precipitously, and that's even in light of this huge uptick in the number of cases. So that's all great news. Yet in spite of that, we have Warden Newsom continuing to lock us down, and unfortunately other states as well. Governor Abbott, as you know, in Texas, and DeSantis down in Florida, retrenched and did a 180 on their reopenings, and it defies logic, and it certainly defies the science.
Warden Newsom, that's a very apropos for what's going on since we're back into since we're all back under house arrest on this whole thing. Couple things that I want to get to. I mean, the double talk of Newsom, we'll get to this in a little bit, but the video that's coming out, the fear-mongering video that you're going to kill your mom, your grandpa, your friends if you go out on that. But I don't know if you caught the Orange County health official, Dr. Chu or whatever his name is on that, came on today about 2 o'clock. And he said, and I've been on the phone with the OCPIO and stuff trying to decode that, but it seems like from April to sometime in June, 30,000 cases that were tested as under for coronavirus antibodies were figured into the positive cases. But according to Dr. Chu, what he said, and nobody at OC has been able to verify this, they were able to separate this out when nobody knew. So wait, how, along with all the other, with the whole mask fiasco, we don't know what to believe. Masks are good, masks protect you, masks don't, da-da-da-da-da. Now we're finding, it seems like we're getting real proof in California that these numbers are bogus as you know what.
Right, and that's what I've been saying from the beginning, Roy. I have never claimed, nor would I, that this virus isn't real. We know that it's real, and we know that there is a select group of the population, a subset of the population, who can get very ill with it and end up in the ICU or end up dying from it. And we know who those people are. The numbers, however, are not real, and they've been wrong from the beginning for a number of reasons. The one you just pointed out is absolutely spot on and not happening just in California. What the CDC has done is they have conflated positive cases of the virus with positive antibody tests, and they've added those two together. So they have wildly increased the number of cases by adding in the people who tested positive for antibodies. In addition, one of the most egregious problems is that one individual, if that person is tested multiple times, and many people are, by the way, many people, for example, test positive, then a week later, before they go back to work, their employer says you need to test again, so they test again, and then they're still positive, so a week later they test again. So one person may be tested 3, 4, 5 times. That person is counted, each time they are counted as a new, quote, case. So one individual, you, Roy, could be counted as 5 or 6 or more cases of coronavirus, which is obviously, patently absurd. So those numbers are added. Then there's the whole issue of counting people as being admitted to the ICU or dying from COVID-19 when they haven't even had a test at all, just based on what we call a presumptive diagnosis of COVID, meaning they had symptoms that were consistent with COVID, fever, chills, and a cough, which is consistent with COVID, but it's also consistent with a dozen other viral infections.
Yes, it's astounding. They're trying. Where's the convoluted logic that well, no, they weren't double counting, or they were counting antibody tests? So, and correct me if I'm wrong, because I don't want to be saying anything that's incorrect. But if you are tested for antibodies, that means you were exposed to the virus, but you no longer probably have it. So how could you be concluded as being tested positive on a straight-up coronavirus COVID-19 test that says you either have it or you don't, which an antibody just means you've been exposed to the virus, doesn't mean you had it. More than likely, in most cases, you're going to be immune to coronavirus.
Correct. And Roy, unfortunately, the current antibody tests simply are not that specific. Many of the people who test positive may be positive because they had other coronaviruses in the past. There's an awful lot of overlap in antibody testing. And because coronaviruses are so common, upwards of 20% of all common colds are caused by coronaviruses. So people may test positive for antibodies, and it may not, that they may never have even been exposed to COVID-19. We simply don't know. So the numbers, people keep hanging their hats on the numbers. And when I say people, I mean primarily politicians and decision makers, and God only knows the people in the mainstream media hang their hats on these numbers of cases. And every day you're hearing, oh my gosh, a record new number of cases. And I'm thinking, first of all, the case numbers aren't correct. But even if they were, even if you were willing to say these are legitimate numbers, we've had 50,000 new cases of coronavirus. Those people, I'm here to tell you, are not getting sick. The cases that are being diagnosed now, are being, recorded now, are not, most of them have nary a symptom, let alone are not being admitted to hospitals and ICUs. Because what happened was, as you recall, people were pounding the desk saying, where are the tests? Where are the tests? We need more tests. So The government responded. They put it all in overdrive. We're testing somewhere in the hundreds of thousands of people a day are being tested, but they're not being tested because they're sick. Back in February, March, April, the only people who we could afford to test were people who were pretty sick and had symptoms and showed up at hospitals because we didn't have enough testing equipment. Now we are rife with testing equipment. There's plenty. So every Tom, Dick, and Harry who wants to walk in and say, hey, you know what? I'm wondering if I got exposed when I was at the barbecue last Saturday. Those people get tested. A ton of them are coming back positive without any symptoms whatsoever. And the great news about that, Roy, is it means we are proving what I've said from the beginning, which is that the mortality rate for COVID-19 is actually far, far, far lower than what we were told back in those early days. Remember, they were saying it's 4 or 5, 6% mortality rate. No, it's actually more like 0.2%, which is on par with, it's not insignificant, but it's on par with an average influenza outbreak.
Another doctor, for those of you that think maybe Kelly Victory's out there on a limb, but another doctor who has some very stout credentials, such as yourself, Dr. Scott Atlas, was just on video here a couple of days ago, echoing the same thing. It's good coronavirus has spread. We got to build the herd immunity. We should be opening up the schools. Kids don't transmit this stuff, and we'll help build that herd immunity with doing this. But he said one thing that I thought was really important, and I haven't heard anywhere else when you hear Newsom or whomever with the statistics that ICU hospitalizations are going up. He said, compared to a month or two ago, hospitalizations are half the time and of less severe and much less ventilator use than they were a month or two ago. So he said the ones that are coming in are probably younger, more healthy, probably don't have as many medical conditions, but maybe they're suffering a little complications. But what I want to get to is go through the protocol. I'm thinking now, if you come in and you test positive for coronavirus, you're like in the ICU, hermetically sealed bubble, yada, 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 till they figure this out. Then maybe, okay, well, you're okay or something or that, and then they're going to do that. But that would explain to me, and he was saying, there's nothing to be alarmed about. In fact, we should be celebrating it, not doing the fear-mongering stuff.
And I agree 100%, and that's what I have been saying all along, Roy. You're exactly right. The cases that we are diagnosing now simply are not severe. If they need hospitalization, it's for a day or two, but most of them have no symptoms at all. And that's also why I've said that the trajectory, the curve of a pandemic always flattens on its own. All pandemics have the exact same shaped curve. Whether you do social distancing, mask wearing, shutting down of the economy or not, they all do the same thing. The people who are most frail, most at risk, most vulnerable get sick early on. You see the big peak, and then over time the curve will flatten. Despite not doing any of these things at all, you don't need to ruin the economy. The curve will flatten all on its own. And another thing that I will tell you that you are not hearing in the mainstream media because people aren't looking into it, when they say there's an increase in hospitalizations, and you heard this a lot, for example, in Arizona, and you heard it in Houston, Texas, that the hospitals had a huge increase in hospitalizations. And they did have an increase in hospitalizations, but they weren't COVID-19 patients. The people who were getting admitted to hospitals in Houston, to the 4 big hospital systems, were people who tragically had delayed care for other things, diabetes, heart disease, asthma, emphysema. All of a sudden, people were showing up at the ER when the state reopened, and doctors are saying, oh my gosh, why did you wait so long? And they're saying, because I was afraid to come in because of COVID. So the ICUs in Houston are full, not of COVID patients. They're full of diabetics and asthmatics and heart disease patients who should have been in the hospital or gone to see their doctor 8 or 10 weeks ago, but delayed it because of this ridiculous lockdown.
You said it I know Dr. Scott Atlas of Stanford University Medical Center, that little old medical school, not very famous, I don't think, that has said the same thing. That so, and people ask me, especially you referring to me. Well, are you an expert? No, I have no medical degree, nor do I give medical advice. But I interview a lot of smart people. I tell people I'm not very smart, but I know a lot of smart people, and I'm smart. I am smart enough to listen to them, and I mean, if we would stop. I mean, like you said, that I didn't get the Houston part of that, and I'm very glad you pointed that out. And you've been saying it, and a lot of others have been saying it. What is going to be the ultimate damage of this of people that didn't seek medical care over this because they were afraid, or you told them not to go to the hospital, or you just made the atmosphere just with the latest fear-mongering ad that Gavin Newsom's coming out with is absolutely despicable?
Well, back on June 9th, so now a month ago, the CEOs, the two who are both physicians, of the Cleveland Clinic and the Mayo Clinic, two premier hospital systems in the United States, they wrote an op-ed that ran in the New York Times on June 9th saying that based on what they are seeing in their two huge tertiary care centers, deaths that are going to result from the lockdown will outpace the deaths from the virus itself. And I've been saying that from the beginning. More people will die as a result of this lockdown than would ever have died from the virus. And those two hospital systems, Cleveland Clinic and the Mayo Clinic, should know. These are people who are on the ground saying, here's what we are seeing. Now you're watching it real time in Houston as people run in and flood the hospitals because they sat at home with their diabetes and their hypertension and their heart disease and their emphysema, not getting medical care. I guarantee we will see an uptick in delayed diagnosis of cancer for all of those people who didn't get their colonoscopy, didn't get their mammogram, didn't get their skin cancer screenings during all those months of February, March, April, May, June. Those things matter. There's a reason we put people on routine screening schedules. There's a reason it matters. And I'll tell you right now, if I were a woman, for example, who went in finally, come August or September and got a mammogram that was supposed to have happened back in February and found out that I had a lesion, you will always wonder, oh my gosh, had I been able to go in February when I was supposed to go, would my outcome have been different? Would they have found this earlier? Would they have been able to, do a different treatment other than a radical mastectomy? Those sorts of things will haunt those people, and they have a right to ask those questions.
It is, and just for example, and this is what drives me crazy. Let's just say life expectancy, round numbers, is 80. Let's say the average patient that's died of COVID-19 right now is at 40. Let's just say the numbers are even, but there's a lot more people in the lower category. But let's just put 100,000. Let's say it's 100,000 on both sides. 100,000 died of COVID, 100,000 died because they didn't get medical treatment. But you take the average years. Okay, the 70 group would have lived another 10 years, but you sacrificed 40 years off the same amount of people. You did 4 times more damage than if you would have just left it alone.
There's no question. And the tragedy on top of this is when you look at this particular disease, COVID-19, the target group, the risk group for this particular virus are those people who really are elderly. We say over 70, but it's really, if you look at the deaths, let's face it, they're well over 80 years old with comorbidities. Not that those people aren't important, but what they aren't is they aren't the working people. They aren't the people who run the economy. So we could have protected those people, kept them isolated, rallied around them, and taken care of them without decimating the economy. This is very different, for example, from the Spanish flu outbreak back in 1917, 1918, when the target there was young, healthy people. And that was devastating because the people who were at higher risk were people in their prime working years, people in their 20s, 30s, and 40s. So trying to protect those people was tough if you're trying to keep the economy going. But with COVID-19, oh my gosh, the idea that we shut down all of these businesses, destroyed the lives of millions and millions of Americans. There are small businesses that will never get back up and going again. And that's tragic because those people were never at risk. And certainly children are not at risk. They're not at risk to get it, and they aren't at risk to spread it. But we have an entire generation of kids now who have missed the better part of a year of school. They're missing social events, sporting events, all of the interactions that you're supposed to learn. You simply cannot do that while you're sheltering in place at home, doing your 2 hours of computer school work on a daily basis, and then going to a grocery store where you see nobody who's not wearing a mask. I mean, I really wonder what the heck these kids are going to turn out like.
It is, and they've been doing. We went through it yesterday when Stephanie was in it. Her kids are, like anybody that gets sick now, they're afraid they're going to die because of all this stuff that's coming on, and that's even, that's as tragic as anything else is coming on. Anything else? Got about a minute, so I'll give you that to wrap it up.
Yeah, well, I'll tell you a chilling story. I received an email from Harvard School of Public Health, where I got postgraduate education, the School of Public Health there, that said they are opining that it will be safe to open schools again as long as we, now get this, their words, not mine, as long as we foster a culture of compliance.
Oh, God.
Okay? If that's not Orwellian, Roy, I don't know what is.
You're making my day.
So be safe, enjoy your 4th of July, get outside, and know that eventually this will all be behind us. But I think we got a little more crazy to go.
Thank you, Kelly Victory. We'll do it again next week.
Sounds great. Take care.
Man, that's that. And I have the picture of the CNN report up here, but Trump came out with today, he had a press conference, talked about the economy, 7.5 million jobs. People went back to work in the first 2 months, and that records, I think, 700,000 blacks, 1.5 million Hispanics, 3 million women were among that, the overwhelming majority of that in there. 80% of small businesses were back. I'm afraid that this yo-yo cycle, because the worst thing you can do is open it up and close back down again. Businesses, look, especially 4th of July weekend. Look at all the restaurants and that grocery stores. They have to prepare. People are going to be. They were preparing for people to barbecue, do that. They're ordering food in that. Now restaurants are back closed. Everything else, and we're fighting this little battle coming on. And on top of this, they were just getting opened up. It takes a lot of money getting everything back in. You got to clean the store, get everything supplies, a lot of capital. You haven't been making anything the last 3 or 4 months, and you get to be open for a couple of days, and then they shut you back down again, or even a month. Man, and then you got to go through this yo-yo cycle all the way through again. So I'm afraid I'm going to be real curious to see what the July report is. Now that some of these, like Texas governor is getting a little weak-kneed in Arizona, along with Gavin Newsom and stuff on that, for no apparent reason. But again, so you want to discount the fake numbers or the stuff we've been going on through that, or the fake media, or thinking just Roy's just way out there on the limb talking about this communist and Black Lives Matter and white guilt and Isaac Knight doesn't know what he's talking about, and yada, Shelby Steele and the whole deal. This is an unbelievable report on CNN. Pull up the graphic, Jesse, please. On that, Little Rock, Arkansas, breaking news live on CNN. Coronavirus kills 2 men in a meth lab explosion. And you are reading that exactly, or for what that's going on the internet, exactly what has been going on the deal. Coronavirus kills 2 in meth lab explosion. I mean, from all I can tell, it could be a hoax, but from all I can tell who's checking it out, it looks like it's not somebody that's done a Photoshop or whatever on that. But how does coronavirus kill somebody in a meth lab explosion of that? You don't think there's misinformation going on? You don't. How, Gavin Newsom, are you saying the positivity rate is going up when you don't even know if your statistics are right? A antibody test is not a coronavirus positive test. It means that you have been exposed to this at some time, and more than likely, antibody means you have developed antibodies and even possibly an immunity to the virus of affecting you. It's called herd immunity we've been talking about, and that's how we ultimately get rid of viruses. No drugs, no vaccine, no nothing. They can help, but drugs can treat you. Vaccines can help with the herd immunity, but there has never been a vaccine that's been 100% effective. I think 60% or something like that is the max rate that any of the best of them are on vaccines are being effective. So, when we go through all this and we run through that, and again, the only way they can do this to you is to fearmonger, like the Newsom deal. The absolute evil, in my opinion, that's behind these new ads that are coming out, trying to shame you into wearing a mask, trying to keep you away from your family, trying to keep it's conquer and divide. The easy one of the tactics, anybody, military, political movement, whatever, to control people is get them separated. It was a funny story with that. I had my little, to go into the store, I had my little sticker mask on my nose and was purchasing some adult beverages, which in California they're carding you, which is ridiculous. And the person's looking at me well, your hair's the same color. So I just took it off. Yeah, you can see on my driver's license, this is me. But that's why I say you can't even tell who you're looking at. So what's the good of ID of having this and all that? We're in stupid times. Nothing else. We'll be back tomorrow on Fast Friday with Stephanie. So until 5 o'clock tomorrow, see ya.